HTx.
Hello, everyone. I'm Emma Kinloch.
My name is Pieter van Galen.
I'm the consumer lead for the National Cancer Research Institute in the UK, and I'm one of the founders of Salivary Gland Cancer UK.
I'm from the Netherlands. I'm 44 years old currently, living in Belgium for the last, I think, about 20 years now. I've been diagnosed with MS in 2006. At that point in time, I had no clue what it was about.
All of this came about after I was diagnosed in 2012 with adenoid cystic carcinoma.
2 years after, 2008, I moved to a new house, and my neighbor across the street, which I met and became good friends, was the director of the European MS platform. So we started working together quite a bit.
I was treated with surgery and radiotherapy. As you hopefully know, there are no targeted therapies for ACC, and chemotherapy has very little effect. I was advised, because of my diagnosis, that radiotherapy was a necessary second part of my treatment after surgery. Clear margins were not expected because of the size and location of the tumour.
And I got the diagnosis from the neurologist. She said, okay, I give you lots of documentation and also medication possibilities for the treatments that we have on offer. And she says, first go back home and read all that and see what seems most appealing to you, let's say.
My treating clinicians in the hospitals, I knew I were confident, were very research active and current and knowledgeable about my disease. And that is not the same for everybody in the UK and elsewhere.
And heard about a new treatment for the same MS type. I said, maybe I'd like to find out more about that. And then I got to talk to my neurologist again. The neurologist was not in favor at all because it was too new and it was not something that hospital did, and therefore had to change hospitals. And I went to talk to a different neurologist who did administer that medication.
So I think there are lots of reasons why a patient might not feel empowered to have that conversation. There's a big variety when it comes to shared decision making. Not all clinicians will signpost patients to different options. And obviously patients have different levels of understanding, which makes the whole thing even more complicated.
To me, it would be very interesting to have a say, at least, in to say, okay, what type of medication could I take and what is the reimbursement? Now, I'm very privileged. In the country I live in currently, all medication is as good as paid back. Yeah, I see how much that costs to the society, and how much I pay.
Those costs have not come up for me within my treatment specifically. However, there are many patients I know who have had conversations around costs in many ways.
If I go more towards Eastern Europe, I know a lot of patients from there as well that don't have the correct access. So for them, it could definitely be a very powerful instrument, I guess, and to see what the government will pay back in the end, or the government, the social security within the government.
I think there's, amongst some people, a sort of a reticence, if you like, to trust AI, but maybe that's just a lack of understanding. Patients want the most reliable method, and if that's proven to be AI, then so be it. I mean, those choices are so individual and will be completely dependent on all the different variables. And I think the decisions that patients will make will be, of course, will be different at different stages, but would be different if you ask them the same question at different periods of your life.
I had my MRI taken one time, and so the doctor looked at it And then I had the MRI looked at by a company that is doing all the MRI research. And so the computer came up with this and this and this. And all of a sudden it showed that my brain volume had actually increased, whereas normally it should go down because of the disease. Sometimes a different outcome is possible through AI than what doctors can see sometimes even. And then thinking, if you're going to get a proposal from a computer or big data, AI, of a treatment to take, people might be scared and prefer to listen to a doctor. Whereas I feel that if a computer has analyzed through big data and is completely unbiased, doesn't know you, but has a look at all the different people with a similar medical history, I mean, I think the two together could really work. Yeah.
Everything that we do now in terms of our protocols and our guidelines and our licensed drugs and our developed therapies, all at one stage were unknown and experimental. And there isn't a one size fits all. It's about having the option. Patients should be involved all the way through. And even when you think that they can't be involved, that there are ways, and it makes a huge difference to have collaborative working with patients all the way through. Yeah, no, absolutely. Historically, there's been certain areas of research where it's been very challenging to have patients involved. And I think that is changing now. Ask us. We're here to help. we want it to work as much as you do, believe me.
HTx-H2020.eu